All right, now let's continue to get reaction. We're now joined by Dr. Kgosi Letlape, founder of the Africa Medical Association. Thank you so much for your time this afternoon. So this bill, I mean, it's faced criticism from all fronts, political parties to some quarters of the private sector, with many, as you've heard in that clip that we played earlier on, saying that the legislation in its current form will limit instead of improve the healthcare for South Africans. Just your reaction, perhaps, to this bill, which will now be signed into law tomorrow by the president.
This bill creates a third tier into our healthcare system and is not addressing the challenges faced by our healthcare system. In the private sector, we had a market inquiry report of 2019, which has not been implemented. In the public sector, our primary problems are not money. Our primary problems is incompetence, corruption, inappropriate management, and having staff members in areas that don't matter, and lack of staff members on the front line. And none of these issues are being addressed by this bill. It also does not recognize the expertise that lies in the country. Whether we're talking about the Council for Medical Schemes or we're talking about statutory bodies that are the ones that sanction professionals and ratify them. They now want to subsume that function. There's also poor governance where this fund will be totally controlled by the Minister of Health, and it will be a honeybee for deployment. Things will be outsourced because you are not utilizing the competences. You want to start a new department inside the Department of Health, which hasn't got a good track record on financial management. We've just come out of the scandals of COVID. Babita Deokaran paid with her life. People were buying skinny jeans, and you're not fixing those fundamental problems. So the NHI would be like creating a fund to put water in a leaking bucket. Why are they not starting with themselves? The Medical Schemes Act is an act of parliament. Why are you creating a third financing mechanism for healthcare in the country instead of fixing the problems that we have, reforming the medical aids? And if you wanted to make a national system, nationalize the medical aids, make the necessary reforms out there. But there's a lot of competence and expertise in terms of how to handle funds. When you look at Section 27 of the Constitution, it talks about health for all within available resources. Our problems are not resources, but how we manage them. By increasing resources without improving how we manage them, you are just creating a feeding trough for the current cadres of the current ANC.